Hi, everyone. Welcome to For the Health of It, Health Insurance 101. We are going to start here in a little bit. We're just going to let people kind of come in, give them a few minutes, and then we'll go ahead and get started. We are recording this, so feel free to turn your cameras off. That's totally fine. And if you can mute your mics, that's even better so that we can make sure we can hear everything okay. But just hang tight. We'll let you know when we get started here just in a couple minutes. Hey everyone, as you come in, welcome to the For the Health of It Health Insurance 101 for Money Smart Day. We are recording it, so feel free if you're more comfortable turning your camera off. And then if you can go ahead and mute your microphones, that way we can make sure we can hear the speaker okay. I usually like to give people a couple minutes to come in, so we're gonna start here in just a couple minutes. I'll let you know. I think we're probably pretty good, so I'll go ahead and get started. And if people come in late, I'll just kind of admit them on the back end here. But I'm Shannon Osborne. I'm the Assistant Director for Financial Wellbeing. So we're really excited for our first annual Money Smart Day. And this is our fourth session out of 6 sessions for today. And this one's for the Health of It, Health Insurance 101. And I'm excited to have Nora here to present. She is from Student Health Services. And we were just talking a little bit beforehand before we got started just on how important it is to choose a health insurance plan. And you really don't realize how important until you actually need to utilize your health insurance. So thinking about these things beforehand, when you do get that first job and they tell you which, you need to choose a health insurance plan, what does that necessarily mean? So you guys have a chat, so go ahead throughout the session. Feel free to type any questions you have in the chat. And for the people coming in just now, we are recording, so feel free to turn your camera off. And then we'll go ahead and we will get started. So Nora, I'll pass it off to you.
Awesome. Thank you, Shannon. Hi, everyone. My name is Nora Lemire. I'm the Health and Wellbeing Coordinator at Student Health Services, and today we're going to be discussing health insurance for the health of it. So today we'll define some of the common terms used in health insurance. I know health insurance can seem like a daunting and really dense topic with lots of jargon. So we're going to try to define that jargon, make sense of what health insurance is, able to recognize some of the loopholes. We'll also try to identify options for enrollment. So see how you can enroll in health insurance. And then also generally just see how health insurance works and what factors may affect your coverage. So we'll start off by defining some common terms. And as Shannon said, feel free to drop your questions in the chat as you think of them, and I'll address them as I see them come up. So first off, premium versus deductible. Those are probably the most common 2 terms that I've seen thrown around, and both have to do with money, either the amount of money that you pay or the plan pays. So premium is the amount of money that must be paid for your health insurance plan. there are two parts to it. There's how much your plan in general costs, but oftentimes when we speak of a premium and we refer to it, it's the amount of money that the patient, the person who's insured you, how much you are paying for your plan. If you are under your employer's health plan, then your employer generally pays for most, sometimes all of your plan. And they may pay that like on an annual basis or a monthly basis, but what you pay generally, if it's your employer's check, if it's through your employer, then you might opt for like a deduction from your paycheck. So for most people, that would be biweekly. So that's what you pay to have your plan, basically. What your deductible is the amount of money that you owe the health plan before your health insurance plan begins to pay for your services. So here's an example to put this into context. If your deductible is $1,000, then your plan won't pay until you have paid $1,000 out of pocket. It really depends insurance plan to insurance plan what applies towards your deductible. So do your copays apply towards your deductible? Do out-of-pocket expenses apply towards that deductible? It really differs plan to plan, but generally the term means how much money you have to meet in order for your plan to begin to pay for you. Note that the deductible may not apply to all services, and your deductible, I learned the hard way, resets annually. So one time I went to the ER in the fall, and by the time, because of that bill was so steep, I ended up meeting my deductible, but what happened was I met it by the end of the year. So then come January, their deductible reset. So that's just something to be mindful of. So you might be thinking to yourself, okay, well, what am I paying for, right? If you have to pay for your premium and you have to meet a deductible, what your premium is, like what you're paying for essentially in getting a healthcare plan, is covered preventative care. So through the ACA, or most commonly known as Obamacare, now all insurance plans do cover preventative health care. So when you have health insurance and you're paying that premium, you do have preventative healthcare services covered. What are preventative health? For women, that's going to be like an annual gynecological exam, your annual health checkups, flu shots. If you ever see signage at like a CVS or a Walgreens, it'll say free through health insurance. So as long as you have a health plan, those preventative services should be covered. You're also paying for your health insurance plan. And this is not necessarily always like a common sense thing, right? Like, why am I paying for health insurance? But it's basically in case something were to happen. So you're paying to have that insurance, right, for your health. You can also think of health insurance as a coupon. It's essentially giving you a discount on in-network healthcare services. So you're paying a subscription kind of to this health insurance in order to get discounted healthcare services. If any of you have seen a bill, like a medical bill before, you can see what your healthcare plan covers, but without health insurance, how much that would cover. And unfortunately, in this country, healthcare is extremely expensive. So if you hadn't had a healthcare or health insurance, your bill would likely be many times larger than what it is. Do you have to keep paying your deductible for each visit? No. So your deductible is that annual amount that you have to meet before your health plan starts paying. So it's not what you pay each visit. We'll define that term later on. So copay versus coinsurance, I've also seen these two terms thrown around, and they should not be used interchangeably. So your copay is probably, to me, the easiest one to define and recognize because it's a fixed amount. Generally $10, $20, $25, $40. If you've ever seen those increments, that's what a copay is. That's the fixed amount that you pay for a covered healthcare service each time you get that service done. So each time you go to the doctor, you're going to pay that copay because it's a set amount and sometimes it's listed on your insurance card. Your doctor's office will already know the amount of money that you owe. So you'll pay that set amount every time that you go. And of course, the amount that you pay may vary between services. So if you've ever looked at your insurance card or your explanation of benefits, you can see that a primary care provider, or what they use shorthand PCP, is going to cost different than a specialist, which would, for example, be like a chiropractor or an oncologist, somebody who has a specialized practice. So that's what will take you from like $20 or $25 up to $40. So just be mindful of the kinds of services that you're getting, or like an ER visit. An ER visit could be a set copay, but of course, because it's a more specialized service, it's going to be more expensive than your GP. Coinsurance is a little bit more complicated just because it's a percentage. So it's not going to be a set amount. It's going to be a percentage of the allowed amount for the service. What that really means is it's going to be a percentage of whatever the cost is. So instead of $40, it'll be a percentage of that cost. So for example, you have met your deductible and your plan says that you have a 20% coinsurance. So if the allowed amount is $100 and your coinsurance is 20%, what you would end up having to pay is $20. And your health plan ends up paying for the rest of that amount. So something to keep in mind with coinsurance is that you would have to pay your coinsurance plus any deductibles that you owe. So this example is assuming that you have met your deductible. For copays, on the other hand, as I stated, it's going to be a fixed amount each time you go, and it's per visit. So if your copay is $25 for a doctor's visit, right, to your primary care provider, and you go 4 times in a month, okay, say something is happening, you're not feeling well. So then by the end of the month, what you end up paying is $100, right? Because you've gone to see your doctor 4 times, and for 4 visits, you're paying $25 each. Okay. All right. So cost sharing, another term that's thrown around a lot in health insurance. So cost sharing is exactly what it sounds like. This really means that you and your healthcare plan are both paying for services. So you as a patient are getting a service done, or you want a service done. How do we pay for it? You and the healthcare plan are sharing the costs of the service. That's what cost sharing means. Your summary of benefits also tells you the cost sharing for each service. So I'm going to state this quite a few times throughout the presentation, but please make use of your explanation of benefits, your summary of benefits. These documents are really important to review, and they can be helpful in determining what your copays, coinsurance are, what your coverage looks like. Your summary of benefits will outline the exact breakdown of costs. And depending again on your specific health insurance plan, you might only have to pay copays, you might only have to pay through coinsurance, or you might have a combination of both, just depending on the service. And also coinsurance will not start until you've met the deductible, as I mentioned in the example. And if you have copays, check if those costs are applied to the deductible or out-of-pocket maximum. So definitely make use of your like HR or your health insurance company's like contact number to see what costs are applied to what category. So your out-of-pocket maximum, this will vary in the thousands of dollars. So sometimes 3,000, sometimes 1,500. Again, this would be outlined on your specific plan, but an out-of-pocket maximum also is what it sounds like. This is the most amount of money that you would have to pay during a policy period, which is usually a year. And this maximum would be the most that you would pay before your health insurance begins to pay 100% of the allowed amount. So say you have a lot of health expenses, healthcare expenses, a lot of medical bills, you would meet the out-of-pocket maximum pretty quickly. And this is kind of like a safeguard measure so that people don't go into medical debt, right? If you have a lot of healthcare expenses, the maximum is there so that the premium you're paying to have a health insurance plan kicks in at a certain point, right? And they're saying, oh, okay, we're going to help you with those medical bills if it's more than however much the maximum is, right? If it's more than $3,000 a year, more than $1,500, we're going to start paying for 100% of those costs. Again, it's during a policy period, so it's going to reset annually. This limit never includes your premium. So again, a premium is like the subscription to the health insurance plan. So if I get like $100 pulled out of my paycheck to subscribe to a health insurance plan, that $100 is not going to be applied to the out-of-pocket maximum, nor are any costs for the healthcare services. So say I go to Dr. Bob, my PCP, the copay that I pay Dr. Bob is not going to, if Dr. Bob is out of network, that, or it's not covered under my healthcare plan, those costs are not going to be applied to my out-of-pocket because I'm going to an out-of-network provider. So out-of-network sometimes will work against you, which we'll discuss in a bit. So be mindful of those costs that your health insurance plan does not cover. And some health insurance plans do not count your copays, your deductibles, your coinsurance payments, your out-of-network payments, or other expenses towards that limit. So again, this is where the summary of benefits really comes into play, and contacting your company to make sure that you understand what it counts towards what amount, and being mindful of in-network benefits. So in-network versus out-of-network, what does this mean? So in-network is any services, any treatment you get from doctors, healthcare facilities, or providers with whom your health insurer has an agreement with. So Dr. Bob, I mentioned before, right? If he is considered in-network, then his practice has an agreement with, let's say, Aetna. If I have Aetna insurance, they have an agreement to provide care for the people who are insured under Aetna. So generally in-network, when you visit in-network providers or in-network hospitals, you will pay less out-of-pocket costs if you go to in-network providers. So that's why there's a heavy emphasis on going in-network, mostly because it will end up being cheaper for you. Out-of-network is the opposite, right? Out-of-network means you're getting treatment services from providers, healthcare facilities that do not have an agreement with your health insurer. So I can go to Dr. John, but Dr. John is out-of-network. Of course, as a person with free will, right, I can go see whatever doctor or provider I want. However, based on my insurance, I need to be mindful of whether Dr. John is in network or out of network. Because Dr. John is out of network, then they do not have, their practice does not have an agreement with Aetna to provide health insurance or a covered practice for my health plan for people like me. So what ends up happening is if I go to an out-of-network provider, I will end up paying more out of pocket because I am not going to a provider that is subscribing, right, to the same health insurance plan that I have. So what's the bottom line, right? You can know what's in network or out of network, but does it really matter? Well, it depends, right, on what you're looking for. In network means a better rate for you. So in network, I automatically see dollar signs. It's going to give you a better rate. How do you know if somebody is in network or out of network? Definitely call your health insurance company. I'll show you where the number is listed, but make use of that 1-800 number. It can be a pain to sit on hold for a while, but it's definitely worth your while to make sure that you know what's in network, what's out of network, know the basics of your plan, because plans differ so much between policies and policy holders. It's important to get clarification on what exactly is included in your plan. And also you can contact your specific healthcare provider. So you can call up your doctor's office and ask them if they accept Aetna, for example. That's a good way to check, and generally they know. And that's also when you visit a doctor's office, they ask you for your health insurance information. It's to make sure that they are in network for that health insurance. So there are cases where out of network does make sense for a patient, right? There are some times where out of network can seem like it's better than in network. When does this happen? Here are a few examples. Specialty care. If you're trying to get specialty care, if you have a special illness that you are seeking treatment for, those are times where people consider out-of-network options, right? Preference, if you really like a certain provider and you want to go see them, then you might go out of network. Cost may not be an issue, right? So for some people, cost may not be a concern. You may have out of network coverage when you're signing up for a health plan. There are additional benefits usually listed. One of those add-on options is out of network coverage. This means that you would be paying an extra premium, right? You would pay more money to subscribe to out of network coverage. So you are paying to have that additional benefit and additional coverage should you choose a provider who is out of network. You also may not have a choice, right? So imagine if you're traveling out of state and you have an emergency, more than likely, right, you're just going to want to seek medical attention wherever you can get it and from whoever is available. So sometimes that may mean out of network care. Here are some other considerations to definitely ask your benefits group about. If your primary care provider must give a referral. So referrals usually end up happening if you have like a health complication or an injury, say you broke your arm, maybe before you get an x-ray, your insurance company says you have to get a referral to see a specialist. Where do those referrals usually come from? They usually come from primary care providers. This is another loophole in the American healthcare system. It's a little bit of a roundabout way of seeking care, but this is just might be an additional step that you may encounter in your health insurance experience. So you might have to go to your PCP first, and then they would have to refer you to a specialist in order to get that x-ray. And this is really not necessarily because you need the additional medical consultation. It's how the services are billed. So you need to have that written referral, like a written documentation that you need to see a specialist or you need an x-ray in order for the health insurance to cover the additional service. And be mindful of this, right? Because these are some additional steps that you may have to take in order for your health insurance to cover those services. Also consider if your plan has in-network providers where you live. So being students, if you're graduating soon or you're planning on moving from the area, wherever you may be, make sure that you have in-network providers where you live. So if you have Aetna insurance and you're moving to Colorado, making sure that the providers in Colorado are included in network in your insurance plan. And I'll discuss this later, but if you're like, for example, under your parent or guardian's health insurance plan and you are traveling or moving for school or a job, making sure that wherever you move or wherever you live, you have in-network providers who live close to you and who you're comfortable with and who are in-network. Also consider if your plan covers out-of-network care. Is out-of-network care something that's important to you? Do you have specific providers in mind who provide out-of-network care? That's another consideration. And then also consider if there are any exclusions. And exclusions are healthcare services that are not covered under your plan, exactly what it means. So some common exclusions are, again, out-of-network care and adult dental care. So sometimes if you have out-of-network coverage, your health insurance does pay some of it, but it's not going to be as good of a benefit as in-network care. So you're going to get some healthcare coverage, but you're going to end up paying more than an in-network provider. If it's excluded from your plan, then it's not going to cover out-of-network at all, right? So that's something to be mindful of because that's going to mean a bigger health medical bill. Adult dental care is also a big one. What comes to mind first is orthodontics. So for minors under 18, that's a service, and like fluoride even, for example, that's a service that is generally covered for minors, but once you turn 18 and you become an adult dental care then gets a little bit tricky. So that was another thing. I started getting charged for fluoride and orthodontics changes as well. So if we don't have any questions thus far, I'm gonna play a video that illustrates health insurance pretty well. Let me know if you can hear the audio.
Millions of us now have health insurance.
Sorry about that.
Millions of us now have health insurance under the Affordable Care Act, or what some people call Obamacare. But like many things in life, your health insurance can often be confusing and complicated. Whether you've been insured for years or you're new to the game, understanding your policy is important to your health and your wallet. First things first, you have to pay your premium every month or your insurance could get canceled, kind of like your cable subscription. You can also think of it like a shared healthcare piggy bank. We all chip in each month, even if we're healthy, so the money is there when we need it. If you get insurance at work, your employer probably pays most of your premium, and the rest comes out of your paycheck automatically. If you have Medicaid, you most likely don't have to pay any premium at all. The federal government and your state take care of that. If you're insured through a new health insurance marketplace, depending on your income, you may be eligible for a tax credit that pays a portion of your premium. Once you have that shiny new insurance card, you'll want to try really hard to keep it in your wallet. To better your odds at staying healthy, be sure to take advantage of the free preventive services that all new insurance plans provide. But of course, stuff happens. And that's when insurance really comes in handy. Now, having insurance helps a lot, but it doesn't mean all your health care is going to be free. There are lots of details about your insurance plan that affect how much you pay when you get sick or injured. If you have Medicaid, a lot of these services could very well be free. Otherwise, you'll likely have to pay something when you go to the doctor or fill a prescription. This is called a copay when it's a specific dollar amount, like $25 per visit, or coinsurance if it's a percentage of the bill. There's also the deductible. That's how much comes out of your own pocket before your insurance starts paying. Depending on your plan, you might have a deductible for all your care, or it might only apply to some types of care, like hospital stays and prescriptions. So read your plan material, because it could add up to thousands of dollars. Another important part of your plan is the out-of-pocket maximum. This is the most you'll ever have to pay in any 1 year, at least for the benefits your plan covers. Your insurer will pay 100% of anything beyond the maximum for the rest of the year. It can be just as confusing dealing with prescriptions. Your plan has a list of drugs it will pay for called a formulary, but the prices vary. Check with your doctor or pharmacist because a generic drug might fix you up the same as a brand name drug, but the price difference could be huge. So, those are the costs typically involved. But remember that they'll be affected by your insurance plan's provider network. This is a list of doctors and hospitals that are connected to your plan. Insurance companies negotiate discounts with these providers. Stay in network and the discounts get passed to you. Go out of network and you could end up paying full price. And remember that out-of-pocket limit? It won't work if you go out of network. In some plans like HMOs or EPOs, your insurance would pay nothing if you go out of network. In other plans, like PPOs, your insurance will cover you no matter where you go, but you'll pay a lot more if you go out of network. Also, if you want to visit a specialist, like an orthopedist, some plans require a referral from your primary care doctor. Sound easy enough? Well, sometimes staying in network can be tricky. In a hospital, it's possible that your surgeon could be in network while your anesthesiologist is not. If this happens to you, don't be afraid to negotiate with your provider or file an appeal with your insurer. So as you can see, there's a lot to think about when you choose an insurance plan each year. Some plans may have low premiums, but fewer doctors or hospitals and high deductibles. There are trade-offs, and understanding and choosing among plans isn't always easy. Remember, if you have questions, call your health plan and ask, or check with your hospital or doctor. If you still have questions, your state insurance department or consumer assistance program can help. With the Affordable Care Act, there's new support for consumers, so take advantage of it. Having health insurance protection is a good thing, especially when you know how it works. We hope you're now better prepared for the next time you have to pull that insurance card out of your wallet. Stay safe, America.
All right. Yep, just seeing the chat now. Definitely, you can negotiate and file an appeal after getting a bill. Again, make use of that 1-800 number. And squeaky wheel gets the oil. Make your concerns known and ask all the questions. If you, I used to be a childbirth educator, and I used to always say to the moms who were on my tour to call up their health insurance company. Childbirth is one of those like hot issues in the medical bill world. If you're not prepared and don't know kind of what the landscape is you're going into, as they describe, like your OB could be in network, but then the anesthesiologist is out of network, right? And when you're in childbirth, you're not thinking about getting an epidural, right? You're in pain and you want the epidural, and you're not thinking about who's in network and who's out of network. So those are one of the major procedures that I would definitely recommend. Like, call up your health insurance company, tell them like, hey, this is happening. This is what, what do I need to know? What are the bills? What are the expected costs involved? Who's in network? Who's out of network? ask all the questions so that you can make the best possible decision for you, given all that you've learned. So now what are your options? There are a couple options for getting insurance. Something to note also now through the ACA, everyone should be insured. If you are not insured, then you can possibly get fined when it comes time to file your taxes. I know this because I had to enter like a tax code one year that I had a lapse in health insurance coverage. So it's important to make sure that you have health insurance for at least 1 day for each month of the year. Because that 1 day counts as you being insured for that month. So here are your options. Either your parent or guardian's health insurance plan if you're under 26. Thanks to the ACA, you're not now able to be covered under your parent's health insurance plan until age 26. And then after 26, you'll have to find it through some other forum. You can get it through your employer. That tends to be the easiest after you turn 26 or are off your parents' health insurance plan, because your employer tends to take care of all of the back logistics of getting you insured, and you can deduct your premium from your paycheck, and you can coordinate with a benefits team. You can also get a health insurance plan through the marketplace. And in the marketplace, and I'll show you the website where you can look up plans based on your income and needs. You can either end up purchasing a private plan. So you can purchase a plan from Aetna, from Anthem, Blue Cross Blue Shield, whatever plan you're interested in, and whatever amount of coverage that you would like. So there are some coverages that are like emergency only, right? I call it a skeleton plan, like really bare minimum, just to have some sort of health insurance in the event an emergency happens, aka you need to go to the ER. Or you can get like a more platinum level plan, which would cover more specialty services like orthodontics or eye care, vision care. So those are private plans. And then you can also get government sponsored plans, which, as the video mentioned, would be Medicaid, Medicare. So Medicaid would be based on income. So if you make less than a certain amount of money, and the threshold differs state by state. Virginia recently expanded their Medicare coverage, closing the coverage gap. So if you make a certain amount of money under a certain threshold, then you would be covered under Medicaid, because that means for those who make less income, they're not able to afford a health insurance plan out of pocket, nor are they covered through their employers. So then those individuals would be able to get health insurance through Medicaid. Medicare is for an elderly population. So if you are a certain, I think it's 65 and over, then you would be able to get Medicare. And those two plans are government sponsored. And for under 18, then you would have like a minors plan like CHIP. You can also get it through your university or college. So for example, at Mason, we have the Aetna student healthcare plan, but like Nova, you're not required to have health insurance to enroll. So it really depends on where you go, but depending on your college that you attend, you might also be able to get student health insurance. So how do you enroll, right? You know your options. How do you get there? So open enrollment is a set period during the year where a person can enroll in health or change your health insurance plan. So like for your job, when you start a job and you will have employer sponsored healthcare included as part of one of your benefits. Then once you're hired, it changes company to company, but generally within the first few months of employment, you are able to enroll in that healthcare plan, whether it be January, February, April, October. Throughout the year, when you're a new employee, you can enroll in the healthcare plan then. But then once you've been in that healthcare plan, I don't know what it is for Mason, but there's a set period during the year, usually around October, where you can change your healthcare plan. So say last year I didn't have out-of-network coverage, but maybe I'm interested in it. So this October, I can make a change to my healthcare plan for the next following year because I want additional coverage. I want to change my coverage or add somebody to my plan, right? Another term is a significant life event. So if you experience a significant life event, like you get pregnant, you are over the age of 26, so you aged off your parents' plan, you started a job, you ended a job, you got married, those life events will either preclude you from health insurance or make you eligible for health insurance, just depending on what's happened. But the goal is to always be covered, right? So just depending on your life event, your status may be changed. And I see your questions popping in the chat. I'll get to them in a second. So for healthcare, for the health insurance marketplace, and as a general option, if you do not have employer-sponsored healthcare coverage and you're not covered under a parent or guardian's healthcare plan, I recommend going to healthcare.gov. Through this website, this is the first pop-up you'll see when you go to the website. And it'll take you to a survey that basically asks you all standardized questions. So what's your income? Where do you live? What are your healthcare needs, right? What are you looking for? And it'll show you the healthcare options that are available to you based on your individual situation. And the reason why I asked for your state is because, again, coverage changes state by state and the laws change state by state. So federally, every American should be covered under health insurance, right? Like by law, we all have to have health insurance, but depending on your income and needs, that type of health insurance may change. So for Virginia, again, expanded Medicaid, but we would need to know, right, that you live in Virginia and that's where you reside and what your income is in order to see what you're eligible for. So go to this website, fill out the survey, and then you'll be able to see what options are available to you, and then also when you can enroll. I took this survey once upon a time and it told me, you'll be able to enroll come this open enrollment season. So choosing the right plan for you, I want to show you all this tool. This is through the state of Virginia's benefit plan, but a lot of employers and companies have benefit assessment tools that help you choose a plan. So I say employer-sponsored healthcare coverage, but those, even through your employer, there are several options available to you. So if you want to do it get your plan through Aetna or through Blue Cross Blue Shield, your employer might offer multiple plans and then different levels of coverage within the plans. So even after you get to the point of getting employer-sponsored health coverage, then you have the next hurdle to overcome of, okay, what plan do I exactly want? So I just want to take you through this real quick. And can you still see my screen?
Hello, I'm Alex, courtesy of the Commonwealth of Virginia. Can you hear me? Talking to you? With my voice? Oh, hey, I've been working on my bird calls. Check these out.
Oh, okay, let me share the screen. Thanks for letting me know. All right.
Great, because I am going to help you make smart benefits decisions just as soon as I set up my home office. Ooh, wait a minute. There. Perfect. Now, tell me. Are you married?
So say I'm married.
You are. Any kids?
Sure. 2 kids.
2 kids. What's your zip code?
Let's do Mason.
Okay. Next question.
I work full time.
All right. Every time you get paid, we all chip in toward the cost of having a country. You know, taxes. But one of the benefits of your benefits is reducing how much you personally need to chip in.
Oh, yeah.
To estimate how much you can save, let me ask. What's your tax filing status? Got it. And what's your annual household income, roughly? Just give me an estimate of how much you both earn, any other income. And don't worry, I'll keep all your answers strictly. As we go through, I'll estimate your savings using the most common incremental rates. All right, I got your info. But let me ask, were you hired recently or did you have a qualifying event? Okay, great. Because of that, you can probably change your enrollment elections if you want to, for a little while at least. If you give me your email address, I can send you a link to get... Okay, it's your call. You see the little menu icon up in the left corner? You can click there to see your benefit options, and I'll keep track of your choices there as we go along. Let's start with medical. Before we get into your medical plans, let's talk about COVID-19, or the novel coronavirus. In response to COVID-19, Congress passed laws that require all medical plans to cover 100% of COVID-19 testing costs, including the cost of the COVID-19 test, which is a nasal swab and lab analysis, the cost of any other necessary tests, as determined by the Department of Health and Human Services, and the cost of seeing a doctor, going to the ER, or going to an urgent care facility to get a test, otherwise known as provider services. As long as you're on a medical plan, those should be covered 100%. No copays, no deductibles, no out-of-pocket costs. But it's important to note, this applies only to testing, not to treatment. If you need treatment for COVID-19, those costs would be handled normally by your medical plan, so you'd probably need to pay at least some of them out of pocket. The point is, you shouldn't worry about coronavirus testing costs when you're deciding between medical plans. It'll be covered no matter what you choose. Let me know when you're ready to move on.
Okay, so I'll share my PowerPoint again. All right, so as the module mentioned, for now, because of COVID testing is covered under the preventative healthcare services that I mentioned earlier in the presentation. That means that your health insurance plan covers 100% of the cost. So all COVID tests are 100% covered. So that's a $0 charge to you. In addition to flu shots, your annual exams, like preventative health. So why is it important to take advantage of those preventative services? One, because they're free of charge to you, and you're paying for it right through your premium. And it's a good way to encourage, you maintaining your health, keeping up with your well-being, and also knowing your health status. So different companies, again, have these modules that you can participate in, take surveys, conduct health assessments, like self-health assessments, so that you know which plan is a right fit for you. And of course, these are just estimates and recommendations, but I find them to be helpful in deciding between plans. So you can see by the first questions that were asked, it asks, what is my tax filing status? Do I have dependents? What is my annual income? And all of these questions matter when considering your type of health coverage. So some notes from me on items to consider is one, your health needs. So your level of coverage will differ depending on the plan that you select. So there are plans that cover, might be a more of a expensive premium for you to pay. but there's more healthcare coverage. So the subscription, right, to use colloquial terms, a subscription that you pay for is more expensive out of pocket on a biweekly basis, but you get more health insurance coverage. So if you're somebody who has like a chronic illness, if you have expensive medications that you need to like help with a health condition, if you require extensive treatment, then having the paying for a more expensive plan sometimes evens out, right? And it's more helpful because you need more health insurance coverage. If you are a younger person, right, and you are in good health, you don't really visit the doctor that often, you go for general checkups, and maybe when you like get a cold once a year, then a more expensive plan is not really necessary, you know, just depending on what your health needs are and what you anticipate in the upcoming year. For people who for example, like are seeking orthodontics care, if you want to get braces done Invisalign, then that's something to be aware of. What health needs are you anticipating in the upcoming year? Frequency and types of health visits. Again, are you a person that just does general checkups, right? You just go to your annual gynecological appointment, a health checkup once a year. You just go to your dentist once or twice a year. Or are you visit a chiropractor on a monthly basis or biweekly basis? What kinds of health visits and how frequent are you visiting the doctor? Do you visit the ER frequently, right? The ER and urgent care are the biggest dollar signs when it comes to healthcare. Do you visit those establishments and healthcare facilities often? If you do, then you might need a more thorough and comprehensive plan. What is your income and monthly budget? This matters when it comes to premiums, because premiums are the amount of money that you pay out of your pocket to subscribe to that health plan. So oftentimes it comes down to what can you afford, which is why, sometimes people go for the high deductible health plans because they tend to be cheaper on the premium side, but the coverage isn't as great. Which is why I call it the fingers crossed plans. This is a trap that I fell into when I was starting out my first full-time job and I had health insurance. I call it a fingers crossed plan because it's fingers crossed that nothing goes wrong, right? HPs are easy on the pockets, so the premium is smaller. So there's less money being pulled out of your paycheck when you subscribe to those health plans. But because they're cheaper, the deductible is higher, which if you recall from earlier in the presentation, when the deductible is higher, that means there's less, you have to pay more out of pocket when you seek healthcare services. So the deductible is, you have to pay more in order for your health plan to start to cover your services. So not recommended for somebody who seeks medical treatment frequently. But if you don't need healthcare services, then it's great, right? Because you're not paying much for the healthcare plan. But HDHPs are definitely something to be aware of and just be mindful of when you are seeking health insurance. Do you have any dependents, right? That changes things because then you're seeking care for not only yourself, but also your children. Do you want dental and vision coverage? Those are generally considered supplemental care. So you can have medical coverage. And then if you look at the additional options available, it'll usually be out of network listed, and then dental care and supplemental dental care, which means like orthodontics and oral surgery, and then vision. And then on top of vision, of your general health eye appointments will also be like how many glasses and lens and contact lenses does your insurance cover? So there are levels to each option. And then also your preferred provider. So if you're already seeing a provider now, I would just, before you switch healthcare plans, ask them what health insurance they accept so that you can ensure even after you switch healthcare plans, you will still be able to see the same providers because they will be in network for both your old plan and your new plan. So your insurance card, this is again like a standard like online image, but you'll be able to tell on your insurance card the following items. I recommend keeping your insurance card handy. So keep it in your wallet, carry it with you. You never know when you might need it. So I would keep it with your ID. What will be listed on your insurance card is the name of your insurance company, your member ID, your group number. That information, when you call up a doctor's office, they will generally ask you for that information to ensure that your insurance company is in network for them, or they're in network through your plan. The cost of your visit might be listed, so you can see on this card, there's PCP, specialty, the SPC, and ER listed. So those are copays, right? Because they're fixed amounts for those services. So if you see your PCP and your Jane Smith, you'll pay $25. If you go to the ER, you'll pay $100. It might also list the type of plan that you have. So for example, it could be an HMO or PPO. And then usually on the back of the card, there'll be a contact number for members and providers. So your doctor's office might ask you for the provider number. The number I recommend you make use of is the number for members, which will be you. So make use of that 1-800 number and definitely call up your insurance company with any questions that you may have. Lastly, some resources before I open it up for questions. Healthcare.gov, look online for sure, and then you can call them if you have any specific questions. Your health insurance company is a big one. Of course, your parent or guardian, if you're on their plan, definitely your employer's human resources or benefits department, because they will know the specific plan and policy that your employer subscribes to. So they would be a good first line of defense, and then also your health insurance company. And then if you have the student health insurance plan here at Mason, of course, you can call our office at Student Health Services, and we'll be able to answer any questions that you may have. So thank you so much. I'll look at the questions that came in and hopefully help answer some of them. And feel free to unmute yourself if you have any questions. So in terms of filing for appeals, I don't know the general success rate. You're right, filing for appeals is a bureaucratic process, and it is available for you in a situation of out-of-network care. I think it all depends, as you were saying, Matt. It depends on the context of your insurance. I would not recommend it just on a personal level. I think it's a good fallback if you find yourself in an emergency situation or in an accidental billing situation. Know that you have the right to appeal, but I would not depend on it, because the healthcare system in this country is so incredibly bureaucratic, and it may not end up being successful. And I know a lot of people who have ended up with really large medical bills through these loopholes. So I would keep it in your back pocket if you do find yourself in an unfortunate situation, but I would not depend on it if going into a situation. I would definitely call your benefits number. I would call the doctor's office. I would be aware of what you're walking into. But if a freak accident happens, right, and you're have a medical bill coming in the mail, then I would definitely make use of the appeals process. Do you have to be claimed as a dependent in your tax by your parent in order to be covered by their health insurance? That's a really good question. I would refer to your tax specialist, but I don't think that they're one and the same because of the change in law of you being covered by your parents' health insurance until 21. You can still be filing taxes as a single person, not as a dependent, because you're making your own income and possibly living separate from your parents, but covered under health insurance. And Shannon, jump in if
Yeah, you're good. So your parents can claim you as a dependent up to 24 years of age. So because of that, no, it doesn't look at each other because there's that gap between, not necessarily claiming you as a dependent. So 26 years for health insurance, up to 24 for taxes are two separate things. So they don't have to claim you.
Thank you so much. And Shannon, if you have an answer to the COBRA question.
I asked that one.
You asked that, okay.
Talking about different ones. I didn't know if you briefly wanted to just mention what COBRA is, since after 26 COBRA kick in, and maybe that's not a good thing. So we just briefly talk about what COBRA means.
If you have a good answer to that one.
I was just going to say, a lot of times your parents might say, well, I can still cover you after 26 under COBRA. It basically is the same insurance that your parents were doing for you before, except for it just means that they're paying double for you what they were paying before. It's really expensive. If you can get your own health insurance, or you can get it through ACA, or you can get it through Medicaid, I strongly recommend that versus doing COBRA for sure. But it's a fallback if you need a fallback.
Wonderful, thank you. And Matt asked a question about single payer health nations around the global north and some of the global south. How long is the process to access Medicare Medicaid if you file for unemployment, or if you've been laid off? So again, that would be a significant life event. So if you have a change in your employment status, then that would change your coverage. Unfortunately, one of the themes of today is the bureaucracy of health insurance. So these things might take time if you've been laid off or filing for unemployment. I'm not sure how quickly you can get health insurance, but it would be a significant life event that you have a lapse in coverage. So when those instances happen, get on healthcare.gov and see how you can get health insurance and what you qualify for. In my experience, when I filled out the healthcare.gov survey, I got one answer, but then once I picked up the phone and contacted, I think there was a Virginia specific office. So you contact the office for your state. It was good to just talk to another human being and talk out my situation. And they gave me some pretty great advice. So I think these online surveys are a good way of just getting an idea of what's out there, but I would recommend definitely contacting the specific office and asking them how you can get coverage and what your options are, because it really helps to just talk to an expert about these sorts of things. So I hope it helps.
To add to that too, this did happen to me. I lost my health insurance when I was actually pregnant at the time. This was a few years ago. So I had to go through the state of Indiana and get signed up for Medicaid. It did take a little while till it kicked in, but everything was backdated. So any visits that I had at the hospital, seeing my doctor, anything like that, they covered the bills that were outstanding or anything like that. So anything would be backdated as well too. So Medicaid definitely covers a lot, and they want to help you as much as they can if you lose employment.
That is awesome. That's really good to hear. Yeah, definitely know what your rights are and make sure that you are following up with the right people and advocate for yourself. That's wonderful. Any other questions? Feel free to chat them in. So I would, again, keep it handy in your wallet. I always carry mine with me if that ends up happening. You are never going to be denied healthcare, whether you have insurance or not. What they ask for is like your group number or your member number. Like that's the information that they really need. So that's why the insurance cards exist, is because it has that specific information listed on a convenient piece of paper, but really what they need to know is that information. So if you have it memorized or, handy somewhere, or you have like a picture of it, then you can give that to the check-in person. But like, because there are emergencies, you're never going to be denied healthcare in an emergency because you don't have your insurance card. And that brings me to another topic of self-pay. We didn't cover in this presentation today, but in the event that you don't have health insurance and you're seeking medical care, there are always self-pay options, but that differs facility to facility. So for example, like hospitals, again, because that's a huge price tag, I would contact the billing office for that facility and ask them about self-pay options. When I worked at the hospital, again, in childbirth, I had a lot of patients who would come in who were self-pay. Depending on their situation, they would follow up with the billing office and either come up with a discounted plan or a payment plan. There are definitely other options and ways to appeal and work through the medical bills, but it's always a smoother process if you're proactive about it rather than dealing with it after the fact, because that can be quite stressful. So as much as you are able, have your card and the information handy, but there's always a way around it after the fact if you find yourself in an emergency situation.
And if you don't physically have it with you, they can send you a bill in the mail, and then you can add your health insurance to it after the fact, and then they will re-bill you after they bill the health insurance. So it doesn't have to be just like, as Nora said, it just makes your life a lot easier, but there are options afterwards.
Any other questions?
Well, thank you, Nora. That was an amazing presentation. We do have 2 more sessions today, so feel free to jump onto those sessions later. Oh, it looks like we do have 1 more question here.
So the question is about going to graduate school out of state. Is it still a good idea to be under your parents' plan? This is totally a personal preference, so it's up to you. As an adult, wishing that I could still be on my parents' health insurance plan. Yeah, it really depends person to person. For coverage wise, it really depends on your parents' plan, and if it's in network in Virginia only, it depends on where you're going to graduate school. So we can definitely chat about this offline if you'd like. But just as a general note to everybody, consider again what your health needs are and what providers you want to see. It depends on the student health insurance that you can acquire and the quality of that plan. They really range in coverage. So I've heard of fantastic student healthcare plans and ones that are a little subpar. So if the coverage under your parents' plan is better, that might be something to consider. I would just lay out all your options and see what meets your needs the best.
The other thing I would say too is I think sometimes students overlook Medicaid. If you are above the age of 18 and you're making below a certain amount, and so if you're a grad student, chances are you might be making below a certain amount to qualify for Medicaid. And if it's free, go for it. Definitely utilize the Medicaid that's there. So if you're going out of state, you might research the Medicaid options for that state you're going to, and then you probably would have to get a driver's license and a clear residency for that state in order to get the health insurance there. But you just have to weigh of like, is it worth it? Or should I stick under my parents' plan because I don't want to get a driver's license and a clear residency in that state? And that's where I think it's a personal preference. But I definitely always tell grad students to look at Medicaid as an option.
Definitely. And one other thought I had about that was if for your parents' plan, if it's in Virginia only, it is their out-of-network coverage. Because if you're in need of health services while you're at school, then what are your insurance options then? All right, thank you so much, everyone. If you have any other questions after today, please feel free to send me an email. I'd be happy to help you out.
Yeah, so feel free to sign out, and hopefully we'll see you at the next couple sessions.